Next item on the agenda is items for board discussion. Mr. Smith?
Yes, Mr. Birdie, members of the board, we do have two items for board discussion this evening. Our first item for board discussion is an FCSD COVID-19 update. You do have a packet in your folder, and most of those documents can also be seen on the screen for those of you that are in the audience this evening. Prior to getting started, just would like to say once again, the purpose of this discussion, or this part of the discussion, is to present the board with some data, factual information, so that you can have a meaningful discussion afterwards. So I'll begin the first part of the presentation. You can see there district numbers, August 25th through September 1st. That is the data that we discussed at our previous board meeting. And then we can go to the next slide, which is September 8th through September 15th. Unfortunately, you can't see both of those at the same time on the screen, so I will summarize for you. If you look at the number of students quarantined, August 25 through 9/1, there were 455 students quarantined. The latest data, we had 182 students quarantined. So you had a significant reduction there in the number of students quarantined September 8th through the 15th. Number of students testing positive is very similar. 8/25 through 9/1, you had 57 students who tested positive. 9/8 through 9/15, you had a slight increase, +2, 59. The staff quarantined, 8/25 through 9/1 is 4. 9/8 through 9/15 is 1. So you had a small decrease there, as well as a small decrease in the number of staff testing positive. 15 several weeks ago, down to 9. So you can see the percentages to your right. Again, several weeks ago, 4.72% of our students quarantined. Most recently, 1.89. I will not go over the rest of the data. It's there if you'd like to see it in terms of the percentages. I feel like the board has the highest interest in the percentages of students quarantined. Next, and we won't go into great detail, but you can, and it is hard to read, but you can see the same data by buildings, 8/25 to 9/1, if you have an interest in that. Also 9/8 to 9/15. Some of the most things that might stand out if you take a closer look, obviously, as I've already covered, you had a reduction in the number of quarantines, so senior high is pretty close. One of the biggest decreases is you see the freshman school, 76 students quarantined several weeks ago, down to 12. Creekside went from 108 to 33. Crossroads went from 67 to 22. You do see Central went from 20 to 4. Compass went from 7 to 4. East went from 24 to 9. North also a small decrease from 10 to 8. South has a small increase, 15 to 18. West Elementary also has a significant decrease in quarantines, down from 58 to 12. Next, I'd like to take a look at the absence data. And you are able to see both of these on the screen, which is a lot more easier to make a comparison when you're able to do that. You can see August 26th through September 2nd, and also September 9th through September 16th. A lot of data there. I'll give you a summary. The total absence percentage went down in every building. Some of those decreases were significant. I'll classify as a 5% decrease. And at the same buildings I mentioned earlier, Creekside, Crossroads, Freshman, and West Elementary. COVID absences went down in almost all of our buildings. The exceptions would be North Elementary, that posted a plus 42 absences. Please keep in mind this is over a week period. And South also posted a positive, so plus 24 over that same week period. And again, you can see significant decreases in terms of COVID absences at Creekside, Crossroads, Freshman, and West. Again, the same for their overall absence percentage went down significantly, as did their COVID absences. Obviously, there's a direct correlation there.
Mr. Smith, may I interrupt you for just one
Sure.
second? When you're saying total absences, if one child is sick for 5 days, that's
That's 5 absences.
added, that's part of that total.
Correct.
It's not 92 children, it's 92 days were missed.
Correct. Days.
Thank you
Yes.
very much.
Yeah. The next slide, and this is similar to one of our speakers who shared that sometimes it's hard to compare data from other districts because sometimes they submit data that may be a day off. For example, the Labor Day week. Some school districts may have gone back to the previous Friday, while some posted Tuesday through Friday. So it's not exact. I do want to point that out. We're certainly never trying to mislead anyone, so full disclosure on that. But here's what you have the week of August 30th. You can see the numbers by school districts in Butler County, and you can compare that to the same school districts the week of September 7th. There are a few question marks, maybe one, I believe. But if you're looking, just a few things I'll comment on. If you're looking at students, most districts saw a decrease in students testing positive. Our district saw that slight increase, which I already mentioned, we went from 45 to 49, so a +4 there. Most districts saw a decrease in the number of student quarantines, including our district, which was listed as 303 the week of August 30th, down to 162 the week of September 7th. So that concludes my portion of the presentation, which is specifically tied to local data. I'm now going to turn it over to Mr. Matt Crapo, our Director of Student Services, who will talk about some Butler County data, some Southwest Ohio data, and some state data as well. So I'll turn it over to Mr. Crapo.
Thank you, Mr. Smith, and thank you, members of the board. When we were pulling this data together, we tried to want to listen to what you expressed at the previous board meeting, with keeping it local, maybe Southwest, the county, but some of those areas. So the first page there will identify the positive cases in Butler County from August 15th to September 15th. I did go for the 1 month so that you can see a trend line. If I tried to break it down by a week, it was very choppy, but up and down. But over the 1 month period, you can see where we're at now. Next slide. I took the same title, positive cases, but I included Southwest Ohio. When I talk about Southwest Ohio, I literally chose the counties surrounding Butler County. This one might be hard to read because there's so many counties there, but you can see Butler County would be the pink or the red line, kind of in the middle. And you can see the trends with the other counties. The next slide will show you the hospitalization rates for Butler County. So again, we're going back to just Butler County. Again, the month August 15th to September 15th. You'll see the y-axis has numbered scale 2, and you can see where we're at currently. Next slide will be the hospitalization rates again for Southwest Ohio for all the counties. It's pretty clear that Montgomery County is the outlier in this graph. Next slide will show you the Butler County cases by age. So the y-axis on the left-hand side, you will see the numbers. On the right-hand side, you'll see the age range. At the very top, it's 0 to 19. And the bottom will be 80 plus. The next slide will be hospitalization rates for Butler County. On the y-axis, you'll see a scale of 1. So each blue mark would be one person. Again, on the right side, you'll see 0 to 19 at the top and 80 plus at the bottom. To try to get a little better view, because I do know the blue gets choppy. But the next slide, I did back it up to January 1st through September 15th. Again, at the top, you're going to see 0 to 19. So these are minors being hospitalized from January through September 15th. And then the seniors at the bottom. And then the last slide, the deaths for Butler County deaths, January 1st through September 15th. So throughout this year, minors at the top, seniors at the bottom. And again, I hope this was able to get some data for you guys that you were looking for. Again, if there's something different that you'd like, just ask and we'll try to get that for you. But are there any questions?
Any questions from the board?
Yes.
Mr. Shorter?
Yes, I have some questions. If I could just have my presentation, because I was able to look at some of your data and look at some of the other data sources. Let me move this a little bit. Is that better? Yes. Okay. Oh, sorry about that. Well, you know, it's my southern charm, you know, it's okay. So I did want to just point out your deaths by age. Let's see. This data that you have here is actually not in agreement with what's shared by the Butler County Health Department. I was able to go and pull their information as of September 4th. So you have deaths ending back in April. That's not true. Deaths have been reported all the way up to September 4th for Butler County residents, not at a high number. So I'm going to go by the Butler County Health Department numbers on that. I wanted to reach out and let you know that there was some quarrel with that particular slide, but I didn't have time. I'm sorry.
No, it's okay. And I'd just say for the record, so I know Mr. Crapo on the front page.
I can explain where I got the data from.
Yeah, from the dashboard through Miami, Ohio EDU.
So
Yeah, that's Ohio. Yes, of course.
Yeah,
Yes,
he
I looked
felt
at
like that was easier to read through, so I just want to make sure everyone in the room knows, again, like as we said earlier, there is no intention to mislead anyone. It may just be a matter of one site has one set of data and maybe another site has different data, so.
Right,
So I do go to Butler County, and then in Butler County, there's a link to the Miami, and that's.
There is, and I did see it, so I looked at both, because this looks like a little bit like Braille, but no, I looked at both of those data sources. So at the end, I went with Butler County with the health department, because you yourself have used Butler County Health Department data in the past, so I looked at that. But I do want to, if it's okay, I would like to look at the data, and I've been tracking the data too for our own district, and okay, let's see. Okay, is that better? Okay, yeah, that does make a difference. Okay, so I have been looking at the data. I look at it every day, and I have been just comparing our data. I look at Lakota's data, and I look at ours, and I have been tracking it. So it looks a little bit different, but there are some things that I definitely would like to just point out. So if we can go through the slides really quickly. This won't take long. Okay. First one. Yep. So our total number of students that we've had in quarantine as of August 17th, we've had 949 kids in quarantine. And just looking at the students, we've had 187 cases. So that is consistent if you look at the different time spans. So I looked at when school started up into the recent data, the most recent data. So 10% of our student population over time has been in quarantine. Next slide. So this is where I really want to point out some things. In tracking the data, you can see that the 949 that I have at the bottom, that compares to the 949 that you have on the dashboard. So what I've been doing is I've been tracking it weekly to see where our trends are. And something did stand out for me. And so I just want to make sure that this is pointed out. In your data, you looked at Butler County. You looked at the trends in Butler County, which I think is the right thing to do, and I'm glad you put that data up there. The unfortunate thing is that we are not following the Butler County trend. It was alluded to earlier by one of our speakers that our district has its own trend, and it's not following Butler County's trend. So instead of having a decrease, we've had a continuous increase over each week since we've been in school. The first chart are positive cases, looking at week 1, week 2, week 3, week 4. I suspect by the end of this week, once we get our numbers, we may be up, we might go a little bit higher too. It's possible. Once we get the numbers from today and tomorrow, then we can look at the end of week 5. What I want to point out is for each week, and that's week 1, week 2, week 3, week 4, our trend has gone up in positive cases. Now, initially, our quarantine spikes were pretty high. As you can see, we went up to 303 as reported in your data. So what is interesting to me is that at week 3, we had a significant drop in our quarantines. Our positive cases increased, but the quarantines dropped off the ledge. And so the question that I would ask, because that is a significant drop, and there can only be two things. It's either a change in reporting or a change in behavior. So I'm curious as to which one it is, because the positive cases have increased, but the quarantines dropped off significantly. So as a board member, in following the trend, I would like to understand what's happening with that trend, because that is significant. And so I'm going to ask the question, did we have a change in reporting, or did we have a change in behavior? Are we seeing a ton of more kids wearing masks, or did we change the way that we're reporting? Are teachers still reporting quarantines, or are parents reporting? Not quarantines, but mask wearing.
So I'll defer the question about reporting to Mr. Crapo. I think I know the answer. I don't believe that we've had any change in reporting, but ultimately I will let him respond to that part of the question, but I will respond to the potential change in behavior. And
Okay.
I do believe that there has been a change in behavior. If you recall at our last meeting, we talked about the high number of quarantines due to the fact that we had 3 different athletic teams that had a high number of quarantines. I know that our athletic programs have changed some of their behaviors to avoid situations like that, to try to prevent them from occurring again. I do think our numbers were especially high that week because of those 3 separate incidents that occurred at the same time.
But look at the data, look at the weeks.
Yeah.
So
But-
that's week 2 and week 3, week 4. That's 3 different weeks there.
Yeah. What I can tell you is I think there has been a change in behavior.
Okay.
That's just one simple example. I can't tell you if we have a large number, more people wearing masks. I think we probably have more. We've tried to get the word out that if you wear a mask that you will not be quarantined. So I think that could also result in some change. I don't think all of a sudden we had this huge significant change. So please That's not what I'm saying. But
Okay.
I do think we've had a change in behavior. People doing things strategically to avoid quarantine situations.
Okay.
And I'll turn it over to Mr. Crapo for any potential reporting changes.
Yes, and there has been no change in the reporting. I get the numbers from the principals or the nurses in each building daily. I update those. I try to update those the next day in case there were any changes to the data, if we discover someone was vaccinated or, any variable that was there. And then I report those numbers again to the health department that day,
Right.
which is what we're supposed to do.
So who reports the continuity of masking? Is that the teacher and the parent in conjunction, or one or the other?
So each building is unique on how that would work, but in some buildings, the nurses are in charge of the data, and others, the APs are in charge of the data, but there's a plan in each building where they work with who has been masked, who is not, who's properly being masked, and who's not.
Okay,
And that's
so
when they
we're
report
tracking
it to
that.
me. That's why I wait until the next day to make sure I'm not changing numbers on the website.
Okay, so the reporting really is at the local individual school level, and it's not really, you're not in control of that part.
No, I get the numbers.
reporting is on the individual classroom, the teachers, the nurse, at that level.
Yes.
So when I ask about the difference in reporting, you can only give me what is reported to you. So if you were to dig down or drill down a little deeper, that's probably where you'd have to really look at the reporting differences or any statistically significant changes in the reporting differences.
Yeah, all I can say is the numbers that I put out to you guys in the website are the numbers that were given, so there's no changing
That's what I thought.
of
Okay,
anything.
that's what I thought. So I just want to point that out because that's significant. And I'm happy that we don't have as many kids in quarantine. I definitely, yes, but I am always going to question when I see a drop like that. And like I said, there's only two reasons why you would see a drop like that. And the main two reasons would be a change in reporting or behavior. I'd love for it to be a change in behavior. I'm just concerned about changes in reporting. So anyway, that's what I wanted to say. The positive cases in our district continue to increase. They're not following the Butler County trend, which is decreasing. Our district numbers are on the increase. Next one, please. Okay, so this data, I pointed out this time slot because I am just going to compare this information to Lakota. But one thing that I want to point out that's significant is right here for Creekside, between September 7th and September 10th, we had 14 positive cases and 8 quarantines. So that stood out to me because it doesn't follow any of the other trends. And so I'm just pointing that out. It's an outlier. And so I thought that I would just bring that up because we're talking about reporting, we're talking about quarantines, we're talking about positives. That stands out. Next slide. So this is where the comparative data is for me. I think it's really important to just compare our district to our neighboring district. And I compared it to Lakota. This is Lakota's data from the time period of September 7th through September 10th to make it consistent with our data. So the total number of positive cases that Lakota has had has been 161. I'm only counting students, so my numbers will be different from some that were reported. I'm counting students. I did not include staff. So if you want to compare for the same time period, our district, we have 11 schools, we have 11 buildings, 11 potential buildings for spread. So for that same time period, we've had 152 positive cases. Lakota has 25 buildings, 25 classrooms, or not classrooms, 25 school buildings, not including their staffing office. I'm including their academy as well. So they have 25 schools. We have 11. If you follow that data, and if you break it down on a case per school basis, we are twice as significantly high as Lakota, where the mask mandate is. So for 152 cases over 11 schools, the rate is 13.8. That is cases per school. For Lakota, 161 cases over 25 schools, 6.44 cases per school. So we are over twice as more positive. We are creating more positive cases than our neighbor where a mask mandate exists. And the best way to compare it is school by school. You don't need to compare it to the population because the population is not all together at the same time. You compare it building by building, where we have 11 buildings. They have 25 buildings, 25 opportunities. As twice as high the opportunity to generate spread. And they are not close. We are significant. Our data does show that Fairfield is a conjugate. We are spreading. We have COVID spread in our district. And it's not statistically significant. Well, it is statistically significant. It is significant. It is higher than the rate for Butler County. It is higher than our neighboring district where there is a mask mandate. And this is the data. It's the data. So we are different. We are different. And to say that we're not is a problem for me. If we don't want a mask mandate, unfortunately, okay, say you don't want a mask mandate. But the data...
Stop. Excuse me.
But the data, the idea that we are not significantly different from our neighbor, no, we are. We are significantly different. And so I just want us to be realistic about what's happening. I do not want a mask mandate, but I'm not going to ignore this data. I can't. We should not. We should not. And my job as an elected official is to do just what I did. Yes, I'm elected. I've been here for 12 years. So, threats to send me out of here, they don't really.
Excuse me, Mrs. Shorter.
I'm here to tell the truth.
Please do not interrupt, Mrs. Shorter.
Thank you
very much.
I'm just here to tell the truth. Yeah, it's not a popularity contest for me. It isn't, because that's not how I'm built. So when I see this, I'm going to point it out. If you don't like it, I'm sorry. If you want to ignore it, you can. But that is where we are. We are twice as more likely to be conjugates of spread in our district than our neighboring district. And that is not acceptable. And it should not be acceptable to anyone. Those are the numbers. I even corrected the 152 to make sure that I had the same time period. It's the same time period. There is something going on here. We're higher than Butler County, and we're higher than our neighbor. So the idea of just living in this land of roses where we're fine because our data shows that we're fine. I'm sorry, no, it doesn't. It does not. So then you have to make a decision. What are you going to do? And so, see if I have any more. If you can go to the next one. This is from the Butler County Health Department. This is vaccinations. As you can see, the vaccinations for our county, we're going down. We're not even getting vaccinated, right? Next slide. And the cases, look at the cases for the area codes. 45011, I know that's a portion of Liberty Township, Fairfield Township. The cases per week, 413. Look at 45014, 378. Everything is, we've got a lot of cases here. So it's just a problem. If you can go to the next slide. Okay. These are the hospitalizations, and thank God from August, the hospitalizations are down, but we still do have some hospitalizations. We have people who are sensitive. We have people who are medically fragile. We have them in the school building. We have staff that are somewhat more medically fragile. We have kids that are. Next slide. So the deaths, here we are. That's where we are. We have had deaths in Butler County, unfortunately, and no one wants that. No one in this room wants that, and I totally believe that. But what I don't want us to do is to live in a land of Lollapalooza, thinking that we are statistically different when it comes to the spread of COVID, or different in a way as whereas we're not spreading it. No, we're spreading it. The district is spreading it. It's a hot spot. So next slide. Okay, so this is where the conclusions are for me. I'm seeing troubling trends in the data as it pertains to positive cases versus quarantines. I haven't gotten a good answer on that. So I'm inclined to believe that the way that we're reporting has changed, and that those quarantine numbers, if we hadn't made any changes in reporting, probably would be a lot higher. So I'm nervous about that, and I'm sure that I'll get more information from Mr. Smith about that. I would just like to say that, yes, the governor and Children's Hospital officials are begging districts to implement mask mandates. The mask mandates are necessary to stop the spread of COVID-19. We are statistically different from our neighbor that has a mask mandate. I recommend that we look at these conclusions, and I will be making a recommendation tonight for pre-K through 6 mask mandate. I will be making that. Okay, sweetie. So I will be making that recommendation for a pre-K through 6 mandate tonight, because that's what I'm supposed to do. Look at the data and make a decision that's best for the district. Other board members will make their decision. I make mine.
Okay, any other comments from the board? Any other comments from the board? Mr. Begley?
Sure. I had a prepared statement. One thing I just want to speak to, and I think Mr. Smith can maybe even speak to it right now. I feel like you're implying there was a change in the procedure, the reporting, and you spoke about him collecting the data and inferred that maybe something is going on at the school level. And they may not be able to speak to that directly, other than to say that there's been no change from administration as to how data is to be collected or reported.
That is correct. And our employees across the district have been doing this for quite some time. And, we have monthly meetings. We talk about, a lot of us live in COVID world right now. I feel like that's unfortunately what we spend most of our time doing. And Mr. Crapo, we've called him Captain COVID before, because he is the contact for each of our buildings, and he communicates a lot with the Butler County General Health District. I know he contacted the Ohio Department of Health this week seeking clarification. Neither one of us are aware, and I'm not sure why any of our folks would just randomly start changing how they are reporting cases. I don't have an explanation for that. We can certainly go back and confirm with all of our folks at the building level, hey, just want to review and make sure we're all on the same page, and this is how we do that, and we're happy to do that. I spoke with someone today. A lot of us, sometimes we just don't have an explanation for the data changing. I offered, the 1 week when we were at 303, I think we had 80-something student athletes who were placed in quarantine. And that would take us down to roughly 220, which is a significant decrease. Next week, 2 weeks from now when we discuss, or 3 weeks, when we discuss this again, I think, I don't know. We could see an increase, and that wouldn't surprise me. But I don't think the increase would be because we made a change in terms of how we were reporting. You know what I'm saying? Like, I don't think it's as simple. It's not that simple.
I know.
I have faith in our people. I understand.
It's what the kids are saying too, as to how
I just,
the information
I
is
have
being
faith in the
reported.
people we work with every day across this district. They're exhausted, they're overwhelmed, but they are committed to doing things the right way.
And it's a
Now,
lot
I'm
for them
not
to
saying-
track
I'm
who
not
has a
saying-
mask on and who doesn't.
I'm not saying that maybe there hasn't been, someone's made a mistake at some point in time. Please understand me. I'm not perfect. I know our people are not perfect. But I know they strive to be perfect. Just this week,
They're under a lot of stress.
Mr. Rice accidentally was putting, maybe it was students in one box and staff in the other. I can't remember which one it was, but my point is, he put the data in the wrong box because he's human and he made that reporting mistake. But once we figured it out, we went back and made that change. And I just, I want you to understand, I want to promise you that there is no one in this district who is intentionally changing reporting protocols to bring the numbers down. I wouldn't be surprised at all if the numbers go up in 3 weeks, because I think it can. I don't know. I'm not an expert.
So, Billy, my only issue with that is it would be less stressful on our staff if they didn't have to track who had a mask on, calling parents to find out whether or not that child consistently wore a mask. That's a lot of stress on the staff. And that's not something that they should have to do. So I'm concerned about the staff too, and I don't want it to ever be said that I'm not.
I understand.
So that implication, no, sir. I do want it to be easier on our staff because I think there's a lot of pressure from parents who are not wanting to see their children in quarantine. I think there's pressure from parents to not want their child in quarantine and reporting. There's a lot going on there. But I do want the staff to have less burden, and with the mask mandate, they wouldn't have that burden. So the idea that I know that they have a hard job. I'm acknowledging that. I would like for that job to be a little bit easier. I'd like for that pressure to be off them, because if we had a mask mandate, they wouldn't have to go through and cipher through, trying to figure out, okay, I remember he had on a mask. She didn't. I wrote that down.
I understand.
That's where I am on
I
that.
understand.
So,
I understand that.
I'm sorry, Mr. Begley, will you finish your point?
Sure. So my please.
If you don't quiet down, I'm going to have to have the officer remove you. So please let us finish our meeting. Thank you very much.
The prepared statement that I had, based on what I had read on our numbers, which has consistently been what concerns me. Specifically, our positivity rate and the resultant quarantines that it creates. As it was stated tonight, we cannot control quarantine. We work within that system. Quarantines take our students out of the classroom. We do not want that. But I'm encouraged to see our positivity rate is below 1% and the district-wide quarantine rate is below 2%. The Ohio Department of Education, word for word, says wearing a mask will dramatically minimize the chance of being quarantined. We still recommend that and encourage our families to do that. If positivity rates increase significantly, then I would possibly consider a mask mandate, but I see no need for it right now.
Anything else? Mrs. Gundrum, would you like to add anything?
Thank you again, Mr. Crapo and Mr. Smith, for keeping us updated like we asked you to at every meeting going forward. I appreciate all the work that you put into this, and I apologize that I kind of directed you to that Miami site because I thought it was more user-friendly, but there must have been some kind of glitch in it because, like Mrs. Shorter said, there hasn't been thank God, the kind of deaths we were seeing earlier, but it is currently, right now, it is showing deaths since April. But, so there must have been some kind of glitch in it when that happened. Last time I shared some of the information from the Ohio Hospital Association. So just to keep people, in line with the stuff I'm looking at, I'm just going to share additional stuff with that. It is showing an uptick across different age levels statewide.
I have more for everybody else.
Oh, yeah, sorry.
With that one, or-
Yeah, thank you. Across different age groups. Now, they do separate theirs between 0 and 17, where I think the Miami one has, it includes like 18 and 19-year-olds, so, it possibly also includes people who are not in high school or grade school. And then the second one, that is actually the Southwest Ohio section of the state, and that is, I think, 8 counties in Southwest Ohio. The last time we showed a flat line, essentially, for Southwest Ohio for admissions for kids under the age of 18. And you'll see there have been some admissions, but it's not like what we're seeing with the state. What I did find a bit concerning, though, is just north of us where Preble County and Montgomery County in their section, there's a huge spike in hospital admissions for kids from 0 to 17. I don't know why that is. I'm not going to pretend like I know why that is. I'm just showing it to you because it's there. So I don't know what's going on in that south central Ohio section, but you'll see that the child admissions are basically up there with the 60-plus age range admissions. So since we talked about that information at the last meeting, I just figure I'll bring it with me again this time so we can see an update. There is a bit of a lag to their data. They just update it every Monday instead of every day. So basically, what I've said since we first started talking about this, it feels like ages ago, but it was a month ago, was that I want to keep the kids in school. I want them to try to have the most normal year possible. And I am very, I guess, feeling better about seeing our quarantine situation now, because when I tried to look at, I look at the data in many different ways on our website. And when I looked for basically last month, like 10% of our student population has been quarantined. And we have no control over that. That's somebody else's guidelines we just have to follow. And so that had me concerned. I feel a little bit better about it now. I think, like Mr. Bagley said, I feel okay about our positivity rate. I mean, it is obviously, when I crunch the numbers, it is from the start of school till now higher than like Middletown or Lakota, where they've had mandates all year. But I'm not seeing like a huge, like, oh my gosh, I can't believe we have all these positive cases when I'm looking at their numbers for SARS. But the quarantines do bother me, and I think if there were specific parameters, like very short term, I would have to know more about what the parameters were for a mask mandate, but depending on the parameters, I might be willing to do it for a very short-term period, like not indefinite, not for a month or 2 months or whatever, just very short-term. Like we talk about it again in 2 weeks, and then in 2 weeks, and then in 2 weeks.
Okay. Thank you, Mrs. Gundrum. Mr. Clark?
Mr. Smith, thank you for all your hard work. Mr. Crapo, thank you for your hard work. Greatly appreciated. The data can be pulled from either side, and it's never going to match. The closest thing we have is what we have. We're below 3%. I didn't even think about bringing this up until Mrs. Shorter and Mr. Smith were having their discussion. There have been some changes in kids. My daughter specifically did not go to a party, did not go to a group of kids outreach so she could play ball. So there has been some adjustment and sacrifice. I don't like it. She's 17 years old, 16 years old, and I trust she does what she wants to do to an extent, don't get me wrong. Still her dad. But she made a wise choice, in my eyes, to be able to play ball, go to a tournament by sacrificing a couple weekends, and that was her choice. So it's still on us as parents to make those choices, to allow our kids to make those choices. My youngest child was subjected to COVID a few weeks back. It was a cough, nothing more. He stayed home. We did homework. Not everybody has that option for a young student to stay at home, but I do not see a flat, solid reason to mandate masks at this time.
I'm very encouraged by the numbers of our quarantines going down. That was my number one concern. I don't want people to feel like I'm heartless, because I wasn't as concerned about the positive test results. I was concerned more about the quarantine. And those numbers are, in a 1 week's time, we're down 60%. Staff quarantine is down, I mean, it's only 4 to 1, but it's down 75%. And so I'm not as concerned, like I said, of the numbers as far as, I'm not concerned that the numbers aren't accurate. I believe they are accurate. And I think one of the reasons I think that they're accurate is because there would have to be a conspiracy across our whole district that people are not reporting quarantine numbers right. And I do know, and Mrs. Shorter pointed out one particular case where there was more positive cases than quarantines. And that's just possible if they caught COVID outside of school and were sick. So that counts against us as a positive test, but they never came to school positive, so no one was quarantined. So that could be why there's a positive, but no quarantine numbers. And I know that would be unusual, but that is possible. And so I have the utmost respect for Mrs. Shorter, and I think it's disappointing that she's been treated unfairly by members of our community, because you have the absolute best, in your opinion, is the absolute was best for our kids. And respectfully, members of this board disagree on the way to get to where we want to be. But we have the utmost respect for you, Mr. Shorter, and you have every right to bring this data and for us to believe it, because I believe the data you present. I do understand that there was probably some misinformation as far as the number of deaths. I believe your numbers that were reported, because I know there has been deaths in our county. But I do not question the dashboard that we've been given. I think it's been very consistent the way it's been reported. And so, but again, I told you this before, Mr. Shorter, if you were to make a motion that you wanted to amend the agenda to add an action item, I told you I would support that, so that at least we have a vote one way or the other. And if you do make a motion, it should be very specific what you would like it to be, as far as where on the agenda you would like it to be added, what you would like it to cover. Then once that motion is made, to amend the agenda, and it gets a second, and then the board would then have to vote on whether that motion to amend the agenda would be passed. And if it is, we would then add that item as an action item to our agenda. And then when it comes time to vote on that, again, it would need a first and a second to come to an up or down vote on your actual action item. Does that make sense?
Yes.
Okay. And so even if it gets voted onto the agenda to be an item for added, it does not mean that the board is agreeing with the action. It just means that we are agreeing to add the item. Okay? So that's all I have right now. So if anybody else would like to, any more comment? So,
I do
Mrs.,
have.
you want to add one more thing, Mr. Shorter?
I do. I'd like to have Attorney John weigh in. Can you please weigh in as it pertains to the legality of the district's ability to levy a mask mandate?
Well, as I previously indicated to the board, I believe that that authority does exist in the Board of Education under the Ohio Revised Code. We've seen numerous examples of it. I'm not aware of any successful challenge to it, and that's consistent with my opinion.
Thank you. And I think it was also reported by the governor that, and Children's Hospital officials, is that they are pretty close to their capacity. So the ability to take on emergencies that might vary outside of COVID is an issue. I think that was one of their concerns. Just want to put that on the record, and that straining Children's Hospital's capacity for care is at hand, which is why they've asked all school districts to implement a mask mandate. So I did want to add that. I thought that was important. Also, pre-K through 6, Mason City Schools does indeed require masks. I know it was reported earlier that they don't. They do have a pre-K through 6 mandate for kids.
Okay, any other discussion? Okay, hearing none, we'll move on to the next item, which is board policy. Mrs. Aug.
Thank you, Mr. Berding. Members of the board, I have one item for discussion tonight. It's a new policy regulation. At the last board meeting, I presented the new OSBA policy on blended learning, and I mentioned that I would present the regulation at tonight's meeting. So as a reminder, the policy provided us a list of topics that needed to be addressed in the regulation. So that is what is included here, and that is in your board packet. I won't go through every single one. Some of them are more procedural in nature, how often the curriculum will be reviewed, where the assignments can be found. But I would like to highlight just a few of the items. So number 6, for example, students, if we go to a blended learning model, will be asked to use their FCSD device to access content in a blended learning environment, because this device issued to them will have SIPA compliant software installed on it. SIPA is the Child Internet Protection Act, so it's a filtering software. This will also allow us to provide technical support and troubleshooting services to students as long as they're using their Fairfield device. Number 8 is just about attendance and how that might be taken in a blended learning environment. And as you can imagine, it can be done face-to-face. And that can mean in person for the blended learning policy. It could mean over Zoom. It can also be taken or tracked on a learning management system where it's really tracked by work completion. Or it can be a combination of the two of those things. And finally, number 9 is something that we added into the policy at the recommendation of Mrs. Gilbert. It was not a requirement in the original policy, but we wanted to address meeting the needs of students with disabilities. So if they receive certain services in their IEP and we would be in a blended environment, we want to make sure that those services are still being rendered, and number 9 speaks to that. So that concludes my item for board discussion. Any questions for me?
Any questions for Mrs. Aug? And I'm just assuming you're going to want this on the board agenda for next meeting
Yeah, next
for
meeting.
approval. And this is only if at some point we would have to go to a blended learning environment, and this is accordance with state law.
Yes, but we did submit a blended learning declaration specifically for the academy. So we do currently have a small group of
Okay.
students at the academy who are technically learning in a blended environment. So this is for them, and then for us in the event that we may have to go remote.
All right, fantastic. Thank you very much.
I'm sorry, I do have a quick question.
Oh,
I was
sure.
just thinking about, is most of this from OSBA, their recommended language? Okay. I was curious because I saw with the attendance, I know that some of like K-12 and whatnot, they had ran into some trouble with the attendance policies because you had kids that just basically weren't logging in.
Correct.
So I assume all that's accounted for in here?
Yes.
Okay. All right. Thank you.
Okay, great.